Hi, my name is Kweku. I am a pharmacist. In today's video, I'm going to be highlighting 4 classes of diabetic medications that make weight loss difficult. And stay through to the end as I'll be offering alternatives or suggestions that you can discuss with your doctor if you are one of the people that takes any of these medications that I discussed today. Now, with that said, I am not in any way advocating for you to discontinue these medications if you're taking it without first consulting to your doctor. Now, with that said, the first class of medications we're going to talk about is the obvious one, insulin. Insulin for some people, unfortunately, is non-negotiable. So, for example, if you are type 1 or even if you are type 2 and your blood sugar levels are so high that it needs to be brought down within appreciable levels within a relatively short amount of time, you really don't have much options than to go on insulin. Now, the way insulin works is that it causes the sugar or the glucose that is circulating in the blood, which causes high blood sugar to begin with, it causes it to be absorbed into the cell, which is a good thing. That is what we want. You expect that there should not be sugar circulating in the blood, but rather in the cells. But unfortunately, for some people, all that sugar that is taken back into the cells, the body is not able to use it. And this may happen if you are not as active as you're supposed to be, or if you are just eating too much calories than your body actually needs. So what does the body do? Well, the body converts the excess that is absorbed into the cell into fat for storage. On the average, people using insulin gain about 4 pounds in their first year of using insulin. And for some people, it may be as high as 11 pounds. Now, the second class of medications that make weight loss difficult for diabetics is what we call sulfonylureas. And these include glipizide, glyburide, and glimepiride. They work by causing the body or the pancreas to secrete more insulin. And just like I explained previously, more insulin means that more sugar is taken out of the blood into the cells. And if you're not able to dissipate all that energy, then it is converted into fat for storage. On the average, people taking sulfonylureas gain about 5 pounds during their first year of going on any of these sulfonylureas. The third class of diabetic medications that make weight loss difficult is one we call thiazolidine dions, or we call them glitazones for short. The typical examples are pioglitazone and rosiglitazone. So these work by making the body more sensitive to insulin, and they are also noted to cause significant weight gain in diabetics that use them. In addition to their regular mechanism of action, these glitazones are also thought to be involved in the genes that affect fat formation. So you have a double whammy over there. Typically, people taking these glitazones gain about 6 to 9 pounds in their first 6 months of using these glitazones, and even for some people over an extended period of time, they tend to gain in excess of 11 pounds. Now, the fourth group of medications or diabetic medications that may make weight loss difficult is what we call the megalithinites. And typical examples in that class include natiglinide, which is marketed under the brand name Starlix, or repaglinide. Now, these ones work similar to sulfonylureas in that they cause the pancreas to produce more insulin, and as explained earlier, more insulin implies a greater risk of weight gain. But in addition to that, this class is actually reputed to be one of the ones that causes the most rapid gain in weight. So for example, people may gain up to about 7 pounds within the first 3 months of starting on a megalithinides. So I guess the next logical question is, if you are one of those taking any of these medications, what are your next steps? Well, first of all, you can begin by watching your caloric intake and seeing if you can reduce the number of calories or the type of foods you're eating. You can also increase your physical activity, because the idea is that the excess fat is stored because you are not using it. So if you can increase your physical activity, that is always a way to go. The other option is also to consider changing in the medication altogether. I know I mentioned that for insulin, for some people, that tends to be not an option. But what you can consider with your doctor to see, especially if you are type 2, is to consider if any of these newer generation of anti-diabetic medications that tend to cause weight loss. So for example, I can think of Mounjaro or tirzepatide or Ozempic semaglutide. If you are type 2 and it's appropriate for you to be added onto your regimen, that will go a long way to help you in your weight loss journey. Also, you may want to consider and discuss with your doctor some of these newer generation anti-diabetics that tend to be weight neutral. They don't necessarily cause you to lose weight, but they don't also make you gain any weight. So for example, I can think of Januvia, I can think of Onglyza, I can think of Tradjenta. These ones tend to be weight neutral, so you're neither gaining nor losing, and for some people I know that is all that they ask for. Well, I hope you found this information useful. On your screen now are some of the newer generation medications that I talked about, and I go into full detail if you want to review them. Thank you so much. Stay blessed.